Hey everyone, how you guys doing? It's your girl Denise here, and this is Infection Control Diseases Press for Hair Braiding Breaking News. For more updates, you can click here, like, and subscribe. And if you want your Hair Braiders certification, go to braiderscourse.com. Again, I am Denise. I help braiders get their online training and certification to open up their salons today at braiderscourse.com. All right. Today, I want to talk to you all about what's on the front page featured at the CDC, and it's chickenpox. I don't know how many braiders realize, not chickenpox, monkeypox. I don't know how many braiders realize that the chickenpox and monkeypox are in the same family. And when they're saying skin to skin, the scalp is skin. So when you're applying parts and you're rubbing the scalp to apply the edge control, you could possibly be touching these monkeypox. So I wanted to come to y'all and show y'all the signs of monkeypox. They do have it here in Espanol, as you can see. But we want to talk about the signs and the symptoms of monkeypox. You can find this right on the CDC. This is what braiders need to know. They need to know how to refuse a client as well as clean off their treatment tables or their stations or their um, boost, anything that they use, because this stuff is can be on the surface. Some of these communicable, contagious, infectious diseases. All right, but today we're talking about the monkeypox. You'll have a fever, as you can see. You can see the black stipulating of the woman saying her head is hurting. You'll have a headache. You can have some back pain, chills, as well as you can see the hand is loaded with sores. All right, so know the signs and symptoms of monkeypox and when to contact a healthcare professional. So you can learn the signs and symptoms here, right? I have the link in the description of this as well as the link on our blog, but I just thought I'd come to y'all and show y'all here. They soon have the vaccine going to be able to be administered to more of the population. Right now they just giving it to the people that have contracted it and the kids. At this time, on this video particularly, it was 31 kids to my knowledge that had contacted this monkeypox in America. So it's not really just people that have sex with people, like men have sex with men, or women that have had sex with a man that may be on the down low that have contracted this. No, it's some kids that have contracted it. But how to prevent it is here as well. So let's go to her. Protect yourselves. Here is the data right here, and it's mostly close and personal contact. So if they like in your salon or in your chair and you rubbing on them, doing any type of massages, head massages, when you're doing shampooing. So I don't understand why some of these salons, I did link Instyle, but Instyle is saying like, we're not doing that much, but the scalp is skin. And I just want the hair braiders to use precaution. Take your own personal thoughts in and use precaution. All right, so to prevent the spread of monkeypox is say have safer sex. As I teach y'all always, any of these infectious diseases that are bloodborne pathogens are also STDs and STIs. All right, so watch yourself in social gatherings and the monkeypox. Okay, learn how to make informed choices when you are in these spaces and situations where monkeypox could be spread. Right? So they tell you in community settings, home disinfections. Some pets have even gotten this monkeypox. Okay, remember it came from a monkey. All right, it also tells you other resources on how it's spread. But most of the hair braiders do well with their infection control with the 2 parts bleach and cleaning in some cases, or having an EPA cleaner, or even using a barbicide cleaner, but you do need to use it. All right, so this is how it's spread. Okay, how is it spread? Monkeypox spreads in a few ways. Close and intimate contact. Monkeypox can be spread to anyone through close, personal, often skin to skin contact, including direct contact with monkeypox, rash, scabs, or blood fluids from a person with monkeypox. So let's say you poison the scalp, you done ported it to lay your foundation to do your sew and weave. If you're not protecting your fingers, it's a bloody fluids. All right, so this thing could be in the blood, in the blood-borne pathogens. I'm sure it is. Touching objects and fabrics, clothing, bedding, and towels, and services that have been used by anyone with the monkeypox. So you got a cape on your client, or you got a towel on your client, or they in a surface like a seat or a chair. Contact with respiratory secretions. At this point, everyone should be still wearing their PPE, which is their personal protective equipment, so that they can make sure that they had a mask on, because COVID is still out here. We're in the middle of a pandemic, and this is an epidemic, this monkeypox. Okay, this direct contact can happen during intimate contact, including, this is talking about oral sex, but hugging, massage, and kissing. Massage is done when you shampoo hair. And if you cleaning any hair or you braiding any hairs, you are massaging the scalp. The scalp is skin. Prolonged face-to-face contact. You doing a consultation and they standing in your face and you don't have no mask on. That is the problem. Touching fabrics. Fabric. They ain't say no surface. They said just touching just a shirt or something, or a towel you using. And objects during sex that were used by a person with monkeypox and that have had not been disinfected, such as bedding, towels, fetish gear, and sex toys. Okay, so this towels and this bedding, if they didn't touch it, you don't know where they been, if they've been having sex or not, if they turn tricks or what. We don't know. I just want y'all to protect yourself. Okay, a person with monkeypox can spread it to others from the time the symptoms start until the rash has fully healed and a fresh layer of skin is formed. The illness typically lasts 2 to 4 weeks, but that's 2 to 4 weeks once you done got it. Those sores come out for 2 to 4 weeks, but it probably was 2 weeks ahead of time. You didn't see no sore on them, you didn't have no sore, and you caught this thing. People, monkeypox and pregnancy. A pregnant person can spread the virus to their fetus. So y'all have to watch out, especially if you standing up doing her, you can spread it to its infected animals. And scientists are still researching the signs, and the virus can spread when someone has no symptoms. This is what I'm telling you. They cannot have no bumps, no bruises, or nothing, and you up there doing a whole sew and weave, or you massaging and shampooing or talking to them without no mask, and next week you got it, because it takes 2 to 4 weeks for you to get this thing, and it's spreading. So, hair braiders are really just supposed to know the infection prevention and infection control, to refuse a client or know when how to take care of their tools and implements and bedding and sheets and stuff. So I just wanted to come to y'all. There is treatment. I'm gonna leave some type of homework for you to come over here and click and get on this CDC and get updates daily, as I do, on what is going on out here. So right here they have treatment. Right here is the outbreaks and the cases data for 2022. Here it is right now. In the U.S. is close to 20,000 cases right now. Globally is 50 something. So we got more of them. We got over half, almost half of what's required, because it's only 26 to be half. All right, 26,000. Look at these cases. Look at the trends. Look at the global map. Look at the big old circle in America like this. The demographics somewhere. Here is the vaccine. Thank the Lord for that. Okay, here is the technical report on it. And like I said, I want you to come over here and see what the CDC is doing, see what can be done to help with this outbreak, as well as I also have that I picked this up for you guys. If you want to, you can get some liquid gloves. This is gloves in a bottle, as well as still wear your finger protectors and your personal protective equipment. But this is liquid gloves in a bottle. For dry skin, it's 8 ounces. Yes, it's 16, but it will save you. I don't have no affiliate link to this. I just put it up there because, like I said, I'm just here to help the braiders. Okay, so it's a relief from frequent hand washing. You know, you gotta wash your hands. It's a relief from eczema, cracked feet, and diabetic friendly, hands and feet friendly. The home and the workplace, alcohol, sanitizer, scrubs, and it's for irritated and dry skin. All right, it's voted the best hand cream for nurses. And this is how it works and how it shields and the lotion shields you, and you can move about and work shields your skin. All right, and these are a couple of before and afters. A lot of hospitals and doctors use this. I was introduced into liquid gloves when I was younger in Health Careers High School. This how I know all this stuff. I went to a Health Careers High School, as well as once I got my cosmetology license, I just dug more into the etymology and the epidemiology of finding out about diseases and stuff. But yeah, when we used to do biology and we had a scalpel, just like now people are using the razor across your head, we will have on liquid gloves so that the formaldehyde and different stuff didn't get into our skin. So I just wanted to bring that to y'all, as well as the cases from the CDC. Again, like I said, my name is Denise. I'll be coming to y'all with these breaking newses. I love y'all. I come on at 11. It don't say 11 a.m. or 11 p.m., but I do come on at 11. You could click here, like, and subscribe. You can share this if you want to with another hair braider so that she can know the different things to protect herself out here. All right, go out and sow a good seed. And I thank you for joining. Bye.